Following languages: English, French, Deutsch, Italian, Spanish, Portuguese, Polish, Swedish, Czech, Romanian, and passive only Greek. I'm also pleased to announce that we also have this time interpretation in Netherlands. Please note that interpreters rely on the good quality of the sound and video connection of remote participants in order to get your message across. Speakers are invited to speak in one of the languages for each interpretation is available, of course. It is also strongly recommended to speak clearly and at a normal pace in order to help the interpreters to do their work. As always, dear colleagues, I would like to thank all interpreters in advance for their very hard work. Item number 3 on the agenda, 3 and 4, are the votes. We have to vote today on two very important items. The general budget of European Union for the financial year 2021, all sections, and establishing the framework for achieving climate neutrality and amending Regulation 2018/1999. It's the European climate law. I think that everybody knows what we are talking about. On the budget, we have to vote on the budget amendments, and of course for the climate neutrality we have some compromise amendments that we'll have to vote this afternoon. Before opening the vote, it is my duty to verify the quorum. I see on my mobile that our head of unit, Mr. Peter Trang, just updated me that the quorum is not yet clear. But please let's try to check now. In order to verify the quorum, please press raise hand button. Also, the Secretariat will see who is online and who is in the room. Do we have the 1/4 of the committee members or not yet? Okay, then I will just make some announcements because it's not yet the quorum, and before ending my announcements, usually I want
so that we can put you on the list, and then we will see, depending on the number of questions, if we make 1 round or 2 rounds of questions. Madam Gallina, the floor is yours, and I know that you are under some legal constraints in terms of transparency, but I think it's very important that you do not just copy-paste what is already public and what is already in the press, because we know that there are a lot of questions on the degree of transparency of these contracts. They are very sensitive. Nobody in the Parliament is associated to their negotiation, and I think from a democratic perspective it's quite fair to know more than what is already being shared with the public. And just for your information, we will have a hearing September 22nd with CEOs of AstraZeneca, the CEO of the global Vice President for vaccines for Sanofi, and another CEO from one of the pharmaceutical company you are negotiating with. So we will have also questions to them as in parallel with questions to you as part of the negotiating team for the EU. So the floor is yours, and then the floor will be for the members of the ENVI committee. Madam Gallina, the floor is yours.
Thank you, and thank you for the invite. I think it's very good that we have, I would say, the possibility to exchange. I think that this is a public séance, in a sense, where we have it web streamed to people from the outside. So it's a very good opportunity for me to address those who have been elected by the people and are facing the realities much more closely than I would say us who may be lost in the negotiations. So let me also perhaps give you the backdrop to what we have been doing. We have been very much aware that there have been more than 2 million cases of COVID, and that there have been 200,000 people dead. So this is the context. Perhaps because I'm Italian, I'm very aware of it, but this is really something that has severely stretched all our societies, all our healthcare systems. So I think that after all, this COVID threat has immediately shown the importance of EU action to combat such a threat. Now, we have been reacted, we have been quite active. We have tried to give member states solutions, I would say, that were not possible without a good EU crisis management at the centre. I would say that the cross-border health threat decision has helped to exchange information, has been very much used. There has been quite a lot of work going on in the Health Security Committee, where we work with member states, and the measures are discussed, and support is given to specific national measures. There has also been activation of the EU early warning and response system, so that there is permanent communication between the member states. I may say also that we have developed a system for stockpiling of critical medical countermeasures. And I would say that there we have also facilitated joint EU procurement for PPEs, for intensive care medical equipment, for ventilators, for laboratory equipment, and so on and so forth. I also would like to say that the emergency support instrument that is paying for the vaccines has also paid for other elements that were, I would say, very, very interesting for many member states. This was the remdesivir product, Veklury in its trade definition. It also paid for tests for the Red Cross. It also paid for the convalescent plasma action. So this money has been particularly useful. Now, let us focus on the vaccines. And perhaps I would like to start by giving you the idea behind what we're doing. The idea is one of a portfolio. Why a portfolio? Because simply said, one doesn't know which is the good vaccine that is, I would say, going to be successful. We have therefore opted for a possibility to construe a portfolio with the advice of experts and scientists, that was based on elements that were, first of all, time. Time is very important to have the vaccines that arrive, I would say, quickly, and that will have an authorization, because it's clear that we are not cutting corners in that. We also have a second element, which is the efficaciousness and the safety of the vaccine. So in the portfolio, we are taking into consideration vaccines that have already a good profile, from what we have in the first phase clinical trials. And finally, the last element is the price, the affordability. Why? Because it needs to be affordable to all member states and not just to a few of them. The logic of the portfolio, which is built under the experts' guides, is to have, I would say, an ability to cover different technologies, let's call them. They are called in jargon platforms. So at the moment we are negotiating, I would say, in order to have 2 adenovaccines. We have, I would say, 1 recombinant vaccine that is a more traditional technology. And finally, we have what some people describe as the future of vaccines, the messenger RNA vaccines. We have already signed one contract, which is the with AstraZeneca. It is true, as you rightly say, that people consider that we need to be able to speak about these contracts, and I'm here to reply to all your questions. Let me say that the work we have done now focuses on another 4 companies that could end up with contracts, and there is a final one for which we are at the very end of the process of what we call exploratory talks. So before you do the contracts and the procurement, you have to conclude a certain analysis of what the company can offer, both in scientific and in contractual terms. I would say that there are many elements that I could quote, but I would like to also draw your attention to the global dimension. We are very keen, and I would say keen is not the word, we are fully committed to the global dimension. We will never be successful if there is one country first. This sort of approach is not for Europe. We want to have vaccines for all. They need to be a common good, and we need to have them, I would say, as soon as possible for all. So our approach is fully complementary approach with what has been done in the COVAX facility in Geneva. We have just last week pledged support for that facility, 400 million euros as guarantee fund for the developing countries, and we will also contribute to the self-financing part with possible funds that we are trying to put together just in this very time. So I would like to say that it is important to focus on the internal dimension, but the external global dimension is for us paramount. We will not be safe unless everybody is safe. I wonder if I could stop here and get the questions, because I think that rather than have many explanations, I think the questions will be much better for me. But if you wish, I can go into other elements.
No, I think it's a good strategy anyway. You will have plenty of questions, so plenty of opportunity to answer them. So we start with the EPP and Peter Liese.
Yeah, thank you very much.